Good afternoon, everyone. Welcome to Black Health and Wellbeing in a time of COVID and racial injustice. I am Andrea Davis, Professor of Black Cultures of the Americas in the Department of Humanities and Special Advisor on the Faculty of Liberal Arts and Professional Studies Anti-Black Racism Strategy. To help us meet the need of all of our participants today, we have arranged live ASL interpretation and closed captioning. If you would benefit from closed captioning, please bring your mouse to the bottom of the screen and select closed caption and then show subtitle. If you're having trouble with this, please use the raise hand feature and we will assist you privately in the Zoom chat. And Am is going to put up a slide now with these instructions. We also encourage you to use the hashtag YUInFocus to share your reactions and comments on social media, and you'll find that in the chat. I would like to open with land acknowledgements. And to say first, thank you so much to students, faculty, staff, and community members who have joined us today. I know that we're all feeling the stress of what has been an unprecedented and in many ways difficult academic year. And I wanted to provide this opportunity for us to not only reflect on the intersections of a global pandemic and racial injustice, but also to acquire some practical tools that might help us in our own self-care. I'd like to thank the Dean and his offices for supporting this event, which is part of a suite of educational webinars I've had the privilege of hosting this year. A special thanks also to our event coordinator, Nazrin Vakilova, and our communications coordinator, Anam Rahil, as well as to the ASL interpreters, Christopher Deluges and Emma DeHess from Toronto Sign Language Interpreter Service, and Lori, our live captioner from Closed Caption Services. I would like to acknowledge that this webinar is virtual and we are not all gathered in the same area. I recognize that this land acknowledgement might not be for the territory that you are currently on. We ask that if this is the case, you take the responsibility to acknowledge the traditional territory you are on and the current treaty holders. As members of the York University community, we recognize that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territories of many Indigenous nations. The area known as Tikaranto has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As the descendants of Africans formerly enslaved in the Americas, who were taken from their ancestral lands against their will, I am committed to what Tiffany King calls a notion of mutual care. And I recognize that a future for Black peoples is not possible without a future for Indigenous peoples who have lived in these territories for many thousands of years, and by whose leave I live, walk on, and share this land. It is now my pleasure to welcome Dr. J.J. McMurtry, Dean of the Faculty of Liberal Arts and Professional Studies, who will bring greetings on behalf of his offices. JJ, welcome and thanks for coming.
Thank you so much, Dr. Davis, and good afternoon, everybody. I'm so happy to be here with all of you, although obviously virtually. On behalf of the Faculty of Liberal Arts and Professional Studies, I want to welcome everybody here, including, of course, specifically I had a phone call there, including our special guest, Dr. Edna Arie. Dr. Arie, thank you so much for joining us today. I would also like to thank everybody who helped put today's timely talk together. And especially, I would like to thank you, Professor Davis, our LAPS Special Advisor on the faculty's anti-Black racism strategy, and to Associate Dean Michelle Johnson for organizing today's talk. You'll hear from Michelle in a moment. This event provides an important opportunity to both reflect on and discuss the all too real challenges of fighting for racial justice during a global pandemic. The emotional labor of navigating COVID-19, in addition to the barriers and oppressions of structural and institutional racism, must be acknowledged and addressed, especially where it intersects with racial trauma. It is critical that we recognize these challenges and apply a racial justice lens to everything COVID-related, responses to mental health supports here at York University and beyond. I hope and I know that today's event is only just the start of a much larger conversation, and I look forward to more conversations springboarded from this one. I want to thank you again, everybody, for attending today's event, and I look forward to the conversation. Michelle?
Thank you so much. It's also my pleasure to welcome my colleague and longtime friend, Michelle Johnson, in her current role as Associate Dean Students, to offer remarks from her offices and on behalf of our students. Michelle?
Thank you so much, Dr. Davis, and thank you, Dean McMurtry, for your welcome. Good afternoon, everyone. Today's event is a partial response to the multiple pandemics that many of our students have been experiencing and are continuing to experience. Many of our students face the daily challenges of economic marginalization or even distress, which is linked to systemic exclusions and prejudices. To those challenges, we can add the expectations embedded in students' academic journeys, some of which have been delivered in a supportive environment and some of which have not. The COVID-19 pandemic has added yet another layer to those stresses. Courses converted for online delivery, endless Zoom calls, and the terrible scourge of isolation. And the pandemic has also unveiled what many of us already knew, that the adage that we're all in this together did not accurately account for the differential access and health outcomes across this country, this province, this city. That Black, Indigenous, and communities of color have suffered disproportionately due to deeply embedded systemic race-based barriers. And so when the movements for social justice, especially regarding Black communities, took hold around the world, the painful cries that Black Lives Matter were added to the pre-existing pressures and pandemics. This is a time of pain. This is a time of isolation. This is a time when concerns about mental health have been highlighted. This session with Dr. Arie is not merely welcome, it is needed. Thank you so much for being with us today.
Thank you so much, Michelle. And it's now my extreme privilege to welcome Dr. Edna Arie, who completed her doctorate in counseling, clinical psychology, and women's health at the University of Toronto, Canada. She later completed her clinical and forensic psychology residency with the Correctional Services of Canada and Forensics Behavior Services. She has over 18 years of clinical experience, including at the Centre for Addiction and Mental Health, Canada's largest mental health teaching hospital and one of the world's leading research centers. She has also worked at Ontario Shores Centre for Mental Health Sciences, a public teaching hospital, Oshawa Psychological Services, and in various clinical and research roles. Dr. Arie currently works at Advance Health in Toronto, Ontario, as a clinical associate. Her many community engagement activities include volunteering, speaking, and serving as a board member for Immigrant Women in Business, supporting Toronto Black youth in shelters and the SOS Orphan Village in Ghana. I met Dr. Arie about 2.5 years ago, and I felt immediately that she was not only deeply knowledgeable and informed in her practice, but that she was also guided by an ethics of care that was committed to undoing the damage caused by the very systems that were meant to care for us, but that routinely hurt Black people. Thank you so much, Dr. Arie, for joining us today and sharing with us.
Thank you too. It's a great pleasure for me to be invited. I truly appreciate this opportunity. I felt it was like more spiritual than academic to me, because as people of Afrocentric descent or families and communities, sometimes we tend to forget about the spirituality of our existence and the existential meaning of everything that we experience. And so I'd like to use this opportunity to thank York University. When Professor Davis was introducing the other professors, I was like, oh, wow, I have been in private practice for 3 years and have actually forgotten a lot about structure and protocol. So pardon me if I'm a bit rusty today in terms of academic presentation, but I'll do my best. So thank you, York. Thank you to all the deans, the professors. And I would say that without any doubts in my mind, I felt my meeting with Dr. Davis 2.5 years ago was actually something that it was meant to be. We clicked and I did my best to help in every way that I could. I also like to thank all the attendants, the audience, students, professors, teachers, workers. Thank you for coming here. I'm truly grateful, and I would try and share whatever I have been able to gather for this presentation. And feel free to send questions our way. So I'm going to share my slides. So this is the topic that I was offered, and it's Black mental health and well-being in a time of COVID and racial injustice. So this is the agenda here, is looking at the historical and contemporary paradigms of Black health challenges. And then we'll look at COVID-19, we'll look at mental health implications, and then I'll provide some strategies. So I chose this African quote, and if you can see the symbol there, it's an Adinkra symbol connecting us to our ancestry as Black people. So the proverb is, if you want to know the end, look at the beginning. And I found this to be very important because as a group of people evolving collectively, either psychologically or spiritually or maybe physically or health-wise, whatever that might be, or globally, we always have to remember where we are coming from the colonization of our continent, the impact of that on our health, our well-being, and where we need to go, how we need to change the paradigms, and what we can do in that effect. I also think that for younger ones, it's also crucial because if you don't really understand your history, you might not be able to make the necessary changes or the specific or needed interventions that you are required to make within that specific generation. So the first thing here is looking at how colonialism affected the continent of Africa and then consequently health. If you look at the literature or research work done between 1880 and 1910, you would know that Africa was the last continent that was colonized, and it's the second largest continent after Asia. And you'd be wondering how Africa was colonized and why is someone in the field of psychology or psychologist talking about that in a presentation that has to do with our well-being. I would say that colonialism has had or has a direct impact on our well-being, on our coping, or the implementation of even current medical modalities. So Europeans from Spain, France, Germany, Portugal were some of the first people to visit the continent of Africa. And when they went through the economic conquest and a political control, they were able to redefine the whole structure of the African systems. So first, we can say within the history of Africa, the colonizers that came were structured in three categories: the merchants, the religious group, and the economic group. So the religious group, the latter one, came first, and they tend to demonize most of the practices that existed in Africa, including African spiritual healing, and traditional medicine. So by doing that, Christianity or Islam, so let's say specifically because we're talking about Europeans who say Christianity, Christian doctrine was used to demonize African traditional practices, including African traditional medicine. And then secondly, we had the politicians coming in and using their own political system to destroy or influence the traditional monarchy system. So here you have slavery actually taking place in a form of civilizing and improving the lives of Africans. And during the same period, you have vaccination campaigns and pharmaceutical interventions within cities becoming more structured. And this was something that Africans were not used to, but through the political influence or political colonization, Africans were made to follow the European structure of medical intervention. And also the last group is the economic group. So they were quite optimistic, and the whole idea was creating wealth. So in this process, they became quite brutal. So there were a lot of wars, there were a lot of killings, and there were also a lot of deliberate deaths. And this was a way of trying to take the lands of the indigenes. This directly affected the health outcomes of most Africans. So in 1902, a researcher from Europe called Patrick Manson, for instance, called this era the Pathological Revolution. And according to him, the conquest was so violent that people had to flee from their lands, particularly in Congo, in the Sudan, and Uganda. Large plots of lands were taken away from the people. It also led to infertility. There was also depopulation strategies and campaigns, and all was geared towards economic advancement. And this takes us to border crossing across Western Africa and Central Africa, because these were the places that most of the damages were done. And if you can look at the historical pattern, these countries within the Central Western Africa actually endowed with a lot of resources and other wealth. Now you look into the 1924 to 1955 or 1955, where you have the introduction of WHO system, the Rockefeller Foundation, health systems coming in to introduce health campaigns. So for instance, there was this idea that Africans had, so let me go back a bit. During the political campaign and people were fleeing the continent, they were faced with diseases, and some of the diseases include sleeping sickness. And so the Europeans from Germany and France thought they could come in to help. And so through the WHO, they had a blood transfusion kind of clinics. So historically, it was known that these blood transfusion programs actually led to the infection of blood among Africans, specifically with HIV. And this happened around 1955. And I have provided the bibliography for you to look at. And so with the medical transfusion, it was also noted that even though the Europeans were quite optimistic to solve most of the problems or the health needs of Africans, they could not. So this led to the training of a few Africans in the medical field. And again, it was noted that Africa was then used as a place for experimentation. So large African communities, villages were used in these processes. And African intellectuals were being trained in the field of medicine, either abroad or on the continent. So during this period, it is noted that traditional medicine was not even included in the practices of the local people due to colonialism. And again, in North America, I'm sure we are aware of the story of syphilis and yaws that were strategically used among African American natives many years ago. So let's look at the contemporary paradigm. Because of time, I'm going to be a little bit faster here. So in my research, I could not really come across a lot of work done on African Canadians. And so this is the little that I have, but I was able to get a few papers on US and then the UK, African Americans, and then Africans in Britain. So specifically looking at what has happened to African Canadians, we already know that there is a huge disparity in terms of who has access to what kind of services. And this inequity has, in a way, been longstanding. And when you look at the impact of COVID in our community, I think a few months ago, a lot of people were requesting to know whether Black people were having access to services, but we didn't have anything given to us. So what I did was to go to the Health Canada website, and I was able to find one article on the Health Canada website that specifically talked about COVID-19 and African Canadians. So Black Canadians experience health and social inequities linked to process of discrimination at multiple levels of society, including individual, interpersonal, institutional, and societal discrimination. And I think for those of us who have experienced this is a bit straightforward. We can relate to that. And those of us who are not aware of it is that the Black person or any individual carrying a Black body is actually stigmatized wherever you go. It doesn't matter your status. So this actually affects what kind of services you can have. And in a way, it also affects your psychological well-being at the individual level. You get conditioned to behave in a certain way, such as fear. Emotionally, also, you may be triggered most of the time, but these are the daily experiences that we face. 64% of young Black women, these are African Canadian women, age 12 to 17, reported having mental health being in an excellent way. But if you look at them and their peers, Caucasian peers, they have a 77% level of mental health excellence. And someone would say, but the difference is not that much, but it is huge, you know. And I think based on the challenges, based on economic disparities, based on access, and even based on understanding of mental health well-being, based on historical challenges, generational traumas, this is not surprising that our numbers are lower, but it also tells us that as a nation, we can do a lot in terms of systemic changes. Now, the prevalence of fair or poor health for Black women is around 15%. When you compare this to Caucasian women, is a bit lower. So our number is higher. Theirs is around 11%. So there's also a bias reporting, as I've mentioned earlier, that even with COVID-19, the reports on Black families or Black individuals who have been affected or treated or having access to vaccine is not well documented. And this has been a long-standing issue in Canada. Also looking at educational income and wealth outcomes. As you know, these socioeconomic statuses have impacts on well-being, longevity, and health outcomes. And so looking at most Black people, educational level is much lower, income is much lower, wealth gap is much lower. This can directly affect the well-being of the Black community. And looking at this, which I had mentioned earlier in my first slide, if you look at colonialism, one of the things that the colonizer did was to Europeanize medical systems and train Africans medical staff. And they more or less became like the elites in the communities and looked down on traditional practices. But contemporary research shows that most of these westernized medical practitioners have decided to incorporate traditional health practices or respect traditional knowledge or folk medicine. So when you go to places or universities in Africa like Kenya, Ghana, Nigeria, medical schools or medical establishments have traditional medicine schools as well on the same campuses. So it's a way of trying to blend and incorporate traditional knowledge. So now we'll come to COVID-19, which I think by now, everybody on this planet is aware of what COVID-19 stands for, where it started, when it started, where it came from. As you can see in Canada, or Toronto specifically, we were hit exactly a year ago. And in the beginning, and I'll say even now, there's still some misconceptions, about COVID-19. Specifically, I'll speak to my community in the sense that it's not a conspiracy, but we're also spiritual beings. So people are trying to find meaning into this. Is it the end time? Is the world coming to an end? And so for us as practitioners, it's always been our job or our responsibility to provide enough information and let them know that this is one of the medical challenges that we're facing, or health challenges, just like it happened in the 1880, where vaccination campaigns or the germ theory, germ era happened, or even 100 years ago, giving what we all know. So there is a lot of misconception. At the same time, too, there is a lot of education going on. Um, and one of the things that we've noticed, this specifically looks at the UK literature, attitude towards patients, the Black patients, has not been positive. It is noted that several times Black patients with symptoms of the COVID would go in and they'll be turned away and would eventually die. And this we know is due to the race. In Canada, we don't have anything reported on COVID, but we're not surprised if anything is reported that Black people will be discriminated when it comes to having access. And I've also mentioned a gap in the data and misinformation earlier on, so I wouldn't talk about this. And now when you look at most of the workers in our community are frontline workers, they don't have the leverage and access, to work remotely. So they have to be exposed, to whatever is going on with the pandemic. They have to show up at odd hours. They have to work with patients. They have to drive buses. They have to take care of everyone. Basically, they are like the backbone of our community here in Canada, but yet access is still an issue. And also, given the proximity that they have, the close proximity to the virus, they are more likely to be infected. And then we're looking at living conditions, multi-generational homes. And this again is an article on Black Creek in Toronto, where they were educating the community on COVID-19, and they realized that this community was hit the most with the virus because of the living conditions of most Black people in Black Creek, including heavily crowded multi-generational homes. Now, as we know, COVID-19 survival rate is high, and it isn't everyone that is susceptible to death due to COVID-19, but some people are more likely to. And as you can see, a report from the UK shows that COVID-19 hospitalization rates among non-Hispanic Black people and Hispanic or Latino people were both about 4.7 times the rates of non-Hispanic white people. And we can surmise that this can be similar to maybe death, hospitalization among African Canadians, even though this is a UK paper. While there is no evidence, like I've said, the underlying conditions of anyone, particularly Black people, make them more susceptible to COVID-19 infection. As you know, Black people are more susceptible to diabetes, high blood pressure, and sometimes other heart diseases. But let's go through the rest. So we have heart diseases, high blood pressure, lung cancer, diabetes, lung disease, sorry, diabetes, cancer, and people with weakened immune system, older adults. These individuals are more susceptible. When it comes to Black people, diabetes, high blood pressure, heart disease, these make us more susceptible. And I have personally worked with families who have grieved deaths of um, loved ones who had these underlying conditions and got infected with COVID. Now let's look at the mental health implications of COVID-19 among African Canadians. From psychological research, we know that when there's a psychological intervention, 20% of the medical impact is alleviated. And someone will be wondering, what is the meaning of this? So most of the time, doctors would actually ask patients to seek psychological help because they know that it helps in alleviating most of 20% of the medical conditions. So if someone, for instance, someone is stressed and someone is having sleepless nights, or someone is having, let's say, distortions like the misconceptions that I mentioned earlier on about the COVID-19, they are restless and they go into the hospitals, the family doctors or the medical doctors on team would say, look, it's better you talk to someone. And in that way, you actually alleviate the pressure on the medical facility. And I can give many, many examples like stress connected with high blood pressure, or overall well-being, mental well-being connected with eating patterns, sleep patterns. When you look at our literature again on colonial medical systems, it was clearly evident that the mental health care in Africa was never mentioned. It was never taken care of. So imagine people going through war, fighting fiercely with their colonizers who are trying to take their lands, deliberate attempt to, I'm very careful with some words here, but deliberate attempt to infect people's blood, deliberate attempt to conquer communities, infertility, death. And one would be wondering, how were these communities grieving? And so traditional African systems had their own way of coping with their mental health needs, whereby they were very communal, they were very engaged, they were very supportive. But if you have these communities torn apart, people fleeing, from Western Africa to Northern Africa, families no longer together, structures that were in place that protected the communities were all dismantled. You can imagine how that affected the mental well-being of the communities. And most of the time, people do not pay attention to the mental health needs of individuals and communities because you cannot quantify it, either with substances or with money. But looking at the contemporary, I would say advocacy actions, advocacy strategies, including the Black Lives Matter, including some Black health workers, doctors, and psychologists trying to change the narrative and trying to provide appropriate cultural specific interventions to people of African descent, tells you that there is a need for us to pay attention. also, if you look at most psychological modalities, it focuses purely on the mind, just on the brain. And so people get to be conditioned by these modalities. And if you look at how these modalities are implemented, they are ways of colonizing the mind. So these are like deliberate attempts. So the person would more or less focus on their health, on their physical health, and not their mental health. But in the long run, we can all see the implications. Now, I've mentioned that looking at chronic stress and trauma. Here I'm talking about generational trauma, historical trauma. I don't know how I can, overlook this. I work with so many patients, and 90% of them have experienced some form of trauma, be it cultural trauma, systemic racism, workplace trauma. These are things that Black people are more susceptible to, and it becomes complex because of our historical exposure to colonialism, which I have mentioned earlier. For the lack of time, I couldn't go deep into the colonial patterns and the brutality of the transatlantic slave trade. That in itself has direct impact on trauma. Fear and anxiety and depression. This I can, connect it to the conditioning of the mind. If you look at someone who had lived on the continent, even though colonialism took place on the continent, the form of a psychological exposure is slightly different from being in the diaspora. The diaspora, fear, anxiety, and depression, these are extreme and very brutal because the conditioning is more or less focused on punishment and reward. And also, it's covert and it's overt. So if you look at colonialism on the continent, it's more covert, it's hidden. So we treat the white, the Caucasian as a friend. But when you come in the diaspora, you're treated as these objects and you're always under scrutiny and fear. And you'll be wondering, are these the same people that we treat as friends? So these are, some of the discourses that an African Canadian, in the diaspora, tends to question. And also in Canada, the form of psychological a way of control is more of the covert. It's subtle, it's hidden. So you have patients and individuals coming to you who do not even know that the depression, anxiety, and fear they're having at the workplace or in the community is directly linked to systemic covert racism. And again, I've mentioned the conditioning of the mind. At the right time, I might, do a thorough presentation of this, but this is so interesting. If you look at psychological interventions like operant conditioning, observational conditioning, classical extensions, these are ways of conditioning the human mind. And between the 18th and 19th century, a lot of attention was paid to the human mind. So you can see that the mind was studied extensively by neuroscientists, philosophers. Psychology is just a baby among these disciplines. But understanding the human mind and knowing how certain group of people behave was actually the strategy that was used and is being used against Black people. So my last slide. Sorry. So my last slide is on looking at how do we thrive, beyond this, because we're still, living. And so we have to cope in spite of all the struggles and the setbacks. So here I've provided like a collective strategy and then straightforward individual strategies. And this is applicable to looking at the current pandemic or the collective pandemic. Or cumulative, sorry, I wanted to use the word cumulative pandemic, yeah. Because we've been through several of them. So this is what we are experiencing now. So I would say that psychological intervention is critical. If you look at Black psychology research in the United States, it mentions that cultural socialization, is so important. And they've seen the impact where you educate the younger ones on how they can navigate, their lives or their paths in a society that is very discriminatory against a particular race. So I would say that for a young person listening today, find a mentor. And a professor like Professor Andrea is very compassionate. And I think the other professor meeting her today for the first time, I can't remember her name, but based on her intro, you could see that she's also very passionate about the next generation, the community. And these are ways that we can pass on the knowledge by socializing ourselves. And if we socialize ourselves, we know how to utilize opportunities. We know how to also overcome certain setbacks. And also with our allies on the platform here, would also have a better understanding by being more empathic towards the Black culture and the Black community. Here, I would say that cultural modalities need to be changed. I went to U of T for the bulk of my training, and I would say that it was mainly Eurocentric. What I'm sharing to you are some of the things that I know. I had to learn them on my own. Thank God for a professor at McGill who focuses on cross-cultural psychiatry work. And so he gave some of us the privilege to look into other cultural dynamics. So he works with Native communities here, and then he also established a program where he will bring African students or psychiatrists come and spend a year in McGill and train them in cultural psychiatry. So some of us got the privilege to learn from him. But I would say that there is a clear need and a demand for us to shift clearly from some of these psychological Eurocentric dynamics, because they are not helpful. Some of them are helpful, but some are not. And the ones that are not helpful, we need to either stay clearly away from them, create our own, or modify and adapt them. Here, I would say that anti-Black racism as a determinant of health is so crucial. Again, Black psychologists will tell you that anytime race becomes a variable in any situation, is manipulated to always favor the majority group. So for us, it's so critical that we look at anti-racism as a tool, to bring about holistic health and well-being of Black people. Just educating Black people alone on the dynamics of racism, because sometimes when people are oppressed, mentally oppressed, they don't even know they are conditioned that way. And I would always give an example that and forgive me and pardon me for my example, if you're always driving a bicycle and there's actually a Maserati parked down there for you, and you don't have to pay for it, and all you have to do is to go for it. But you're conditioned to believe that, oh, you can just ride this bicycle. So for your entire life, you don't even know that the wealth, and resources are actually yours, but you've been conditioned to live in poverty. And so this is critical. And also preventative drives, health promotion, education, removing systemic barriers. These are all related and intertwined. And then my last piece here is that as an individual, clearly stay away from the virus if you can. I mean, there's a lot of campaign going on by our province, by our premier, by the PM as well, telling all of us to stay safe, you know, but human behavior is very difficult to control. So you at the individual level, you have to be responsible. Wear your mask, know where not to go, know what to do and what not to do. I know we all miss the sun now. I think we moved to the gray zone. So thank God, soon we'll be moving back to a bit of semi-normal life, but do your best. And also in dealing with isolation and quarantine, this is the time for you to connect with friends, you know, family members. Um, get in touch. Don't be alone. Find a mentor. I know it's hard, but try and speak to someone who is available. Don't do all this by yourself. There's always help. And as people are mentioning on social media or research papers, psychological services have gone up because since last year it's gone up, and we are even in the face of fatigue because a lot of people are seeking psychological help because people want to talk, people want to, you know, connect with someone. That's our human expression. We are wired to connect with each other. And I would say this is important to me. I say try and create routines, have a morning schedule, structure it, take a break, have an afternoon schedule, structure it, take a break, have an evening schedule, structure it. So morning, like make sure you have your healthy breakfast, take your vitamins. They say everybody zinc, vitamin D and C as well. You know, eat well, go for walks, call on your friends, watch a movie, sleep well, evenings, have a good dinner, bottle of a glass of wine. Take it easy on yourself. It's a hard time. If you have access to, you know, benefits to call a psychologist, a therapist, please do. But these are basic, you know, make sure you're sleeping well, make sure you're taking care of yourself. It sounds funny, but I'll tell some of my patients that when you wake up first thing in the morning, you know, brush your teeth and put on a lipstick. In that way, you get your mind, you know, geared up in a positive direction. Try and also to reduce boredom and isolation. It's so critical because once you're bored and you feel isolated, there's a tendency for you to have some kind of cognitive distortions. You might not be able to regulate your mood well, and that might not be good for your mental well-being. So I think this is the end of my presentation, and I'm going to end here. Thank you so much. Thank you for the opportunity, and I'm truly grateful. I think there is time for questions and answers.
So Dr. Arie, could you stop sharing your screen? Thank you so much. I know that we're supposed to finish at 1, but I'm going to ask you just to give us 5 minutes. I hope that's okay for the ASL interpreters and the live captioners, just so we can take 1 or 2 questions. And I have to say to the Dean that I'm really looking forward to my next 9 o'clock meeting with him to see his lipstick. Okay, let's see what questions we have. If we have any questions. If you have questions, you can put them in the Q&A. I think there is one there. So this looks like more of a comment than a question, but the president of Tanzania passed on this week, and the cause of death is suspected to be linked to COVID-19. He was an excellent example of misconceptions about origins and effect of COVID. Hospitalization rate, actually I could make this live. Hospitalization rate may be a poor indicator of susceptibility and more likely differential to access to health and healthy life behaviors, regular exercising, diet, taking rest and holidays, work stress, etc. also affects speed of progression. We need to examine these issues before establishing a role or before establishing if Black people are more or less susceptible to COVID or any illness. So that seems to be more of a comment. I don't know if you want to add anything to it, Dr. Arie.
Yeah, so I think with the Tanzania president, I wouldn't, well, in Africa, we say that we do not speak bad about the dead. So I'll use the time to acknowledge the work he's done. He's done a lot for the continent. There could be some misconception. And sometimes you have to validate the misconception that Black people have, that syphilis was also deliberately used, against us. It's well documented. I can also tell you that psychological misdiagnoses were also used deliberately to misdiagnose a lot of Black people, as individuals with psychotic features. So sometimes you have to listen to the community a bit. You also have to look at what the scientific work is saying. So I would say you take both and you do your due diligence. That would be my response. Yeah.
I have a question for you, Dr. Arie. How important do you think it is for universities like York with diverse student bodies and faculty and staff to have counselors that are of their own group? So how is that important to have Black counselors serve Black students?
Yeah, I think that is very crucial because talking to someone who looks like you, representation is key because it has psychological impact on your brain called imprinting. Especially someone who can empathize with your journey and with your story. And I think looking at the struggles that an individual may have gone through from the elementary level all the way to the university, they are at a point where they really would like to, offload or process those experiences with someone who can empathize. So for me, I went to U of T and I'm not shy telling my patients that my PhD was hell. I had to go for therapy after my PhD. And my therapist was, Caucasian, did not understand what I was saying, but eventually did. And what helped me was for me to find a group of women, even though they were all Caucasians, they've gone through some form of trauma, so I could relate to them, So I think it's crucial, it's important. And so I would encourage York to look into it. Yeah.
Okay. All right. Thank you so much, Dr. Arie. I learned so much, and I'm so grateful for you and the work that you do. And I asked that last question because, of course, you know that I agree. I agree with your answer, and I'm trying to encourage, my university, especially the senior administration, to respond to students' demands to have counselors that reflect them. I want to close now by thanking again the Dean of the Faculty of Liberal Arts and Professional Studies, who gives me the space to have these kinds of dialogues and conversations, which I appreciate greatly. Thank you so much to students and staff who were able to join. We are hearing you, listening to you, and doing everything we can to respond to your concerns and to your needs. Thanks also to Professor Johnson, who is such an amazing advocate for students, and to our communications team, Nazrin, Anam, Christopher and Emma and Lori, for supporting us in all of our webinars. Please have a good rest of the day. This evening, it's a Friday. If you drink, have some wine. If you don't, have some tea, take a break, be good to yourself, connect with someone, take a walk. Deeply appreciative of you, and here to support in any way that I can. Thank you so much and have a good day.
Thank you.